Hi, my name is Caitlin. I'm going to be your student nurse today. I'm going to wipe down my area, wait for it to dry, and then set down my supplies. I'm going to provide patient privacy and perform hand hygiene. Can you confirm your name and date of birth for me? Okay, do you have any allergies? No? Okay, we're going to raise the bed to the highest position. It looks like the provider has ordered that we change the dressing on your CVAD and that we change one of the caps. Is that okay? Perfect. To perform hand hygiene again. We're just going to get my supplies straightened. Just to be safe, because I was touching everything. Put on some gloves. How are you feeling today? Are you feeling okay? Good. This procedure will require you and myself to put on a mask, and I will also need you to turn your head to the left. Is that okay with you? Do you have any concerns about that? Okay. I'm gonna get all my supplies ready and then we'll put on the masks. First, we're gonna open this, and I'm gonna just toss this right in the garbage. And I'm gonna take the cap off and we're gonna prime it. Okay. Put the cap back on, so this is good to go down on my clean table. Open my saline flush. I'm gonna toss that in the garbage. And this has the cap on, so it's good also. Okay. We're gonna banana peel my clave. Take the cap off of my flush. Put it on this guy. We're gonna take it out and we're gonna prime it. Okay. And then I'm just gonna set this right back in here. And toss this cap in the garbage. And I'm gonna open my alcohol pad just so that it's ready for when I need it. Okay. I'm going to ask that you put on your mask now and turn your head to the left. You're already a little to the left, but that's okay. Okay, is that comfortable for you? Okay. I will also be putting my mask on now. Okay. So I'm going to get started by taking off the dressing. I'm going to be as gentle as I possibly can. I'm going to stabilize the catheter the whole time. Are you feeling okay? Good. Okay, you are about to be exposed to air. So I'm just going to reiterate how important it is for you to keep your head turned to the left and to keep your mask on. I'm just going to peel this straight away. Okay, I'm inspecting the insertion site and everything looks good. There's no swelling, redness, anything like that. So I'm going to toss this in the garbage and then we're going to get my kit opened. I'm going to now take these gloves off and perform hand hygiene. Okay. Now I'm going to get my sterile gloves on. Toss this in the garbage. This guy opened. this guy on. Okay. I'm going to grab out of my kit my alcohol swab sticks. We're going to open them. I'm going to grab one of them out, and we're just going to clean around the site, just any kind of ickies that might have been on there, making sure to not go back up to that insertion site after I've cleaned it. Okay, all of this is going to go in my garbage. I'm next going to grab my ChloroPrep so that we can clean it. I'm now going to designate my left hand to be my non-sterile hand. So I'm going to stabilize my catheter, and we're going to clean the insertion site for 30 seconds. Okay, then I'm going to move down. We're going to clean all around in circular motions, making sure that we are not going back to that insertion site. And we're going to clean a bigger area than we need, just to be safe. Okay, that should be good. So we're going to toss this now. I'm going to grab out my transparent dressing. Oh, I don't need this. So I'm just going to go in the garbage. And as I'm opening this, I'm just waiting for that site to dry before I put this Tegaderm on. Toss this right in the garbage. Oh, I missed. It's okay, I'll get it later. Okay, the site looks like it's dry, so we're gonna take this backing off and start placing the Tegaderm. Toss this right in the garbage. Okay. So I'm going to try and put that insertion site in the middle of my Tegaderm just so it's easy to visualize. That looks pretty good to me. So we're going to start by putting it down in the middle, securing it there, and then slowly working our way outwards to try and minimize any wrinkles and bubbles. Okay, we're just gonna take this apart and go around the edges as I'm peeling this off. Are you feeling all right, sir? Yeah? Okay, good. That's okay. Get that bubble out. It's alright. Just gonna take this off and we're just gonna put it right there for now. Okay. Finish going around. All right, I'm going to toss my garbage, and then we're going to label it with my initials and the date. Are you feeling okay, sir? Okay, good. Your dressing is back on, but I still ask that you keep your mask on and keep your head that way because we're about to change your cap. Is that all right? Okay. So I'm making sure that this clamp is closed, which it is. So we're gonna just take this off. Okay. And I'm going to toss this in the garbage. And then use this alcohol pad that we opened earlier. Okay. There we go. And we're going to scrub the hub for at least 5 seconds, but probably a little bit longer just to be on the safe side. Okay, and then toss all of this in the garbage. Next, I'm going to grab my saline that we opened earlier. We're going to open this carefully and then just connect that right on. Okay, and then this can just go in the garbage as well. We're going to open the cap. Okay, and it's opened. We're going to pull back a little bit to make sure that it's patent and to see blood return. Okay, I'm seeing some blood return, so I'm going to start pushing, and we're going to push in a pulsating motion, 10 mils of normal saline. Okay, I'm going to reclamp this and then take this off. How are you feeling? Are you feeling okay still? Okay, good. I'm going to make sure that I'm keeping hold of that, and I'm going to toss this. I'm going to grab the heparin and attach, and then toss my cap to that as well. And per the provider's orders, we are going to push 5 mils. So I'm going to reopen my clamp, and then we will just start pushing. Again, also using that same pulsating motion that we did for the saline. Perfect. We're going to reclamp before I take it off. Okay. And then I'm going to toss this. Are you still feeling okay? Okay. Well, we are all done. So I'm going to take off my gloves, toss those in the garbage, perform hand hygiene. You can now take your mask off and turn your head back to normal. Okay. I will also take my mask off. We're just going to toss those in the garbage. I'm going to re-perform hand hygiene. Okay. Do you have any questions for me? Anything that you need? No? Okay, I'm going to provide privacy. We're going to lower the patient's bed into the lowest position. Here is your call light. If you need anything from me, just press that button. I'm going to clean up my mess, toss this in the garbage, and go document.